Hi, I'm Shawn Henry. I'm the Executive Director from the Ohio Center for Autism Low Incidence, OCALI. And we're here today to talk about transition youth with autism, with ASD, and some tips for transition for educators. Chris?
Yes, hi, I'm Chris Filler, and I am the Program Director for the Lifespan Transition Center at OCALI. Shawn and I are here to, as he said, give you a few tips about transition and especially considerations for youth with ASD that might be a little different than for the general population. So we're going to start out actually with looking at the current landscape and what it looks like currently. This data that you're going to see comes from the National Longitudinal Transition Study 2. And we're not going to read this to you, but I want you to sort of look at what the trend is that you start to see as we go through these slides. Employment for youth with ASD as they exit high school and a year later is not good. It's the third lowest of all disability categories. Post-secondary education, only 44% enrolled, and again, the third lowest. We ask ourselves, then maybe youth are doing something else. So we look at engagement rate, and the engagement rate has to do with youth that are either in education, post-secondary education, employed or training since leaving high school. And again, we find that youth with ASD, Shawn, are the lowest of any disability category. Not necessarily living independently, and not surprisingly, social life is not one of the areas that youth are excelling in. So we do know that actually there is room for improvement.
Well, and that's what we're going to get in these tips. Is the tips really are predicated off of those findings, right? Off the research and what it tells us is that we need to change some things for the future. What we've done isn't working, and really I look out to all of you and say that that's what this is about, that we may have to make a choice, hopefully to do things differently, because we know what the outcomes are that have gotten us there. And our true measure of success is that, right? Is the independence, is work, is post-secondary, what they're doing in their adult life. For all students is our success measure. And what we're seeing is for individuals with ASD, those numbers were even lower than the general disability population, which just is unacceptable at this point. And so what we're going to talk about are some tips that we think change really those outcomes in the long term. The first one is believe until you believe, and this is the foundation of all. And we will talk a lot more about that here in just a moment. Using the lens of adulthood, right, and where that gap is between the now and the future. Using the lens of autism, what is impacting various areas that may not be getting enough success out of it, and how we can do things differently. Help is not always helpful. Some unintended consequences of adult support that is really creating a great deal of dependence, and we're going to give you a different way to look at that. Think mobile technology, not just throwing it at them, but really understanding how we could use it to create greater opportunity for independence as well. A focus on social competence, which is just so critically important for our adult life, in all aspects of our adult life in the community. And and finally, how do we put this all together and simplify it? So we're not here for a long time with you, so we're going to kind of go through these. Don't hesitate to write questions down and send them to us later, so we can help clarify any points or give you tools that might support the things we're going to talk about today. So here we go. Believe until you believe. That concept is one meaning that you cannot be a cap to the success of your students. You have to believe that the things they may want to do in any field can be done. I recently was working with a teacher who kind of rolled her eyes when she said, well, this student wants to go into the medical field and be a surgeon. And we really talked through the process that why can't we believe that now? and work backwards, but really the term was just making sure that she would stop and rethink, that if she didn't believe it, but the student wanted to do it, that gap between the two was not going to lead to success. Um, in the book Happiness Advantage by Shawn, he does a really great job in very simple terms laying out that happiness fuels success. It's not the other way around, in that we can have a very successful life, but we want to also project high expectations. But you have to retrain your brain, and you can start to believe it. And if you believe it, the student will believe it. And if you don't believe it, the student won't believe it. And so that goes for the parents, and working with the team is set those high expectations. The Zorro circle is something about management of conquering bigger goals. And finally, we talk about social investment and reaping these dividends of the social network that can be gained over many years. But again, I stop here and say this is the foundation. Everything starts at this point. If you don't believe it, if the student wants to be a train conductor or work with trains or work on washing machines or anything, let's make sure that we're using different statements and thinking differently. And then this next slide, I want you to just step back and think. Do you hear or think these things? Have you heard them in meetings? These are ones that have come right out of meetings we've been in. Don't encourage an obsession. It's a fantasy. So big deal that he knows everything about that particular thing than anybody else in the world. Well, take that and let's reframe it to allowing yourself to think of this instead, right? Think of it in these different terms. And I promise you, research tells us that having higher expectations leads to higher outcomes. So just take a moment, if you will, and kind of check yourself on, and I've done it myself. There are times that students did so much more than they did, so much more in spite of me. And I've learned from that, and I don't want to make that mistake again. That's why I say it's the foundation, because there are these great things that will happen if we, again, I don't want to read through these. You've seen them on the screen, but we want to set that high bar, and that will lead to higher and greater outcomes.
And so while you have those higher and greater outcomes, I think you also want to start reflecting into the future and just what does the lens of adulthood tell us that we need to be working on? It's really a pretty simple concept when you use that lens of adulthood. What you're doing is you're looking at that youth in your classroom or in your program, and you're looking at their skills now as a student. What you want to do then is to put these glasses on and peek through them and say, if this youth were using these skills or only had this level of skill or knowledge, how would that play out as an adult? Would this be sufficient? What's the gap? And that gap between where they are now and where they would be in the future as an adult should be your focus of transition planning. There's examples here of different kinds of gaps, just to give you a sense of how you might visualize this. One on the left would be someone, I get angry, I get upset when I'm told wrong, I don't believe that there is a better way to do it, that's what's happening now. When you put on that lens, you think, this is what I need to be able to do, to accept criticism, to be able to take direction from the boss. The same kind of concept when you're looking at what bothers a person. When I feel upset, I know that there's something, I can't explain it, but I know that it's upsetting me. In the future, I put that lens on and I see that, say I'm in college, I need to be able to explain why that's upsetting me, and what can I explain to perhaps my professor what would make this better, why this affects me this way. That gap between now and then really helps you be able to define the course of study, some of the services, some of the sports. So use that lens of adulthood to help you understand that. This also is something that parents and families need to use. We know everyone struggles with this. Here's an example, and Shawn, we've all worked with families who have done so much to try to support their son or daughter at home. They go beyond what anybody really should have to do. And so this example on the left of taking care of everything and picking out clothes and helping brush teeth, that's a reality for some people. But when you put that lens of adulthood on, no one wants to see that that's what I'm doing for my son or daughter as they're an adult. So we know that there is a gap. That's okay, but we know we need to work on that gap. Along with that lens of adulthood, we go into our third tip here, which is using the lens of autism. And here, this young man you see in the center of this slide is our intern, or was our intern. Now he's one of our coworkers. His name is Casey. But when he came to us, Shawn, we had to use this lens of autism in our offices at OCALI to
Right.
start to understand how was our office, who probably should be more of a friendly environment for people that have some challenges related to autism, but we had never used that lens, and
That's
we
right.
did.
Yeah, we had to really step back ourselves and view that, and I think it was good for the entire staff,
Oh, it
but
was
it
good for all
really
of us.
opened up our eyes to
Right.
making sure that we had the right environment.
Right. And so when we looked at this using the lens of autism, we had to look at sensory environments, sounds and sights. We had to look at our workspace and what that looked like, and was it organized, the structure of the job, the executive function issues, the changes and transitions, which we have a lot of in our office.
Yes, we do.
And the expected social interactions, and how would we explain that to Casey? And communication. We do a lot of communication via technology in our office.
We do, absolutely.
So we looked at this, and we had to look at Casey and understand, how would this affect Casey? We had to use also the lens of adulthood with Casey. And so this video that you're going to see coming up shows when Casey first arrived and what it looked like when Casey first arrived, how he was not comfortable and how he was coming into the office and how he needed a lot of support. So take just a minute, look at this video, and then we're going to go back and talk about what we might have needed to change.
Hi, Chris.
Hi, Casey. Good morning. Good morning. How are you this morning?
Fine.
Cold again this morning. Go ahead and get started. Oops, you okay?
Okay.
Can you hand me mine?
Okay, so we saw that video, and we went back and we looked at those considerations again. And so you'll see on this slide that we found that there's a lot of sensory issues in our office. We have a luxury of having a lot of windows, but that also means lots of sights and sounds and noises. Our workspaces, we did have some personal workspace, but it may not have been organized the best for Casey. We had to look at the job structures and the type of structures, and on and on. And you can see on this slide that we have just many different areas that we had to consider. Some of the social situations were unexpected. Communication, we had a lot of verbal discussions in our office that Casey probably would struggle with. So we put in place a lot of structure for Casey. We put in place an environment and a workspace that would work for him. And we had to look at how we were actually using the people in the workspace, which
That's right.
we're going to talk a little bit more about later. So take a look at this next video and think about Casey's, as he's starting to learn to use these tools, the structured environment, the way that we set the environment up for him. And the use of our coworker, his actual support person, is shifting to help him learn to use this. So take a look at this video of Casey.
So now what's next on your list?
Shedding time.
Okay.
Much time left.
Oh, we have a little bit of time left. Why don't you set that big timer for 10 minutes?
Too many papers.
I know, lots of shredding, huh?
So what you saw there was Casey starting to use these supports. We started to see that by looking through the lens both of adulthood and the lens of autism, that we started to see that we could support those areas of challenge for him. And Casey moved on from even what you see in that video, Shawn. We hired him, and
Absolutely, a great reason to hire him. And if we go back and we think about the lens of autism, the lens of adulthood, we also take one more step back and believe until you believe. Is when he came to us, um, the job coach was there, and at meetings prior to he even taking getting the employment with us and the internship, it was not exactly um, believed by mom, as she stated in the past, or even some of the folks
Right.
that were supporting him, that he could become independent. And now
he is.
is completely independent in
He is.
coming and going and advocating for himself in the environment. And so it's wonderful to see that his mom is thrilled, his grandparents are thrilled, just to see that he has this independence now, that he controls his environment and controls so much more of his world.
Right. And we had to use both of those lenses to make that happen. We had to understand that the characteristics of autism spectrum disorder really would require us to take a special look at the kind of supports he would need. This example just helps you think about it outside of our OCALI office.
Right.
Things like if you were repairing engines in a small business, what might you look at through the lens of autism? How might you need to consider the sounds in that office, the personal space, the smells, the lighting that maybe somebody else wouldn't even consider, or sometimes we might think, oh, they'll get used to it. But for a person on the spectrum, you might have to put some things in place. Same thing around social issues and social expectations with different kinds of people, customers and boss. And then finally, the communication. That could change from time to time, person to person. And you do need to think about not only verbal communication, but slang that might be used and gestures and body language.
Yeah.
You can do this in any environment, and you should for an individual moving into settings such as community college. Again, looking at sensory and social, different kinds of challenges or different kinds of input that you might get in these settings, but you need to use that lens, put those glasses on. Here we have stalking versus initiating. We spend a lot of time helping youth learn how to initiate and greet, but in a college situation, a college campus, that over-initiating could be viewed as stalking behavior. So we do have to be careful about some of these issues. Navigating a new campus is going to be difficult, even if somebody has become independent in a high school situation. A new campus, a college campus, that's going to be very different. So use that lens of autism. We have resources on the OCALI website that can help you with this for you to take a look at, and it helps you think about not only the lens of autism, but also the lens of adulthood. We also have a tool called the Right Match, which again just helps you organize some of this information and gather it so you know where you are going. And finally, we have at OCALI worked with the Ohio Employment First initiative, and one of the things that we have developed in this initiative is a team planning guide for ongoing transition assessment. And this is really based on helping you look at an individual through the adult view and gathering information. And you can see here with Casey, if you look carefully, that the questions that came from using this team planning guide, which is what happens. You work through a number of different steps to identify the types of questions that need to be answered,
Right.
and to identify how you're going to answer those. And so for Casey, we really had to find out what were the possible jobs and how are we going to do that. What will be the routine jobs for Casey? How independent can he be? And so we worked through this process as part of being able to have him be most independent on the job using those lenses.
Yeah, I love that tool. I think it's so helpful and so practical. How many here in the audience have, been in an IEP meeting where they say, a parent may come in and say, my son or daughter needs a paraprofessional, or they need an assistant, and advocate for that? Or how many professionals, or the professional coming in saying, I need, to a principal, I need them to have a professional with them.
A one-on-one.
One-on-one
Yeah.
all the time, one-on-one. Well, help is not always helpful. There's multiple issues that can come up. But one is that adult assistance and prompting must become much more limited. We've really, if we look at the outcomes we talked at the beginning, those outcomes, part of them are a result of having great dependence, great adult dependence. And we know the reality is we don't have that once we transition out of school. It's much more rare to have an opportunity to have that one-on-one, as well as we want to create and have the individual control their own environment, and have much more of that self-determination as they go forward. So it's an unintended consequence of actually wanting to support the student. I mean, it's not on purpose. It's not that we don't want to help, but we really need to step back and review how they're going to help, what they're going to do. We like to call them independence coaches, like set in the tone, change the framework that's what it's about. And so that that individual is really helping and supporting. As we see here, we talk about from the Journal of Autism and Developmental Disabilities. This really breaks it down and just is a great. It really encapsulates the issues that an over-reliance on adult support is really contributing to poor long-term outcomes. So when we think about that, here's one tool that Chris will review that just helps to think about that independence and that help.
Yes, I think the first thing, Shawn, that we want to do is just to recognize where we may be overdoing the help, where independence needs to be developed. And so this is just a very informal tool that helps you start asking yourself, how is that youth transitioning? What kind of supports are they using? Do they use visual supports or mobile technology or something else, or is it all people support? What about their hygiene needs? It helps you start to identify where are the areas that we need to work on. The second page is just sort of a checklist that helps you decide, do we want to work on what areas, and which one area or which areas are we having no problems with, and which areas are we really struggling with. It gives you a way to start the conversation, and it is an informal assessment, and it could be part of your transition assessments that you're using in starting to gather this information. It will be available on this website to download, and if it's helpful for you, great.
Absolutely. Again, when looking at even sensory supports, how are we using those? Is it independent or is it self-directed, right? And so looking at transition, we have to get away from it just being a particular room to what can be used independently in that community environment, in the workplace. Is it reactive or proactive in nature? can the individual themselves advocate for it, or are we always reacting and jumping ahead to make sure we put that in place? This is Brian. He's a great success story. He works at the OSU Medical Center. Brian found that he had some tactile issues at work, and so with that, he tried on these gloves that he had used in the past that he found were not just comfortable, but really increased his focus and ability to deal with those particular sensor issues that were unique to him, the individual. What's great about this success that Brian had is he went and was able to advocate himself. So he tested it out, found that it worked, and went and said, "Can I use this?" Because that's appropriate, right? You can't just, create your own environment in a work environment on your own. You need to be checking with your boss and seeing if this is it's fine. A small accommodation that Brian uses and has been greatly successful with. But it's not until he could recognize it and they were creating supports. That doesn't happen when he gets to the job and all of a sudden Brian recognizes that, I need this support. I'm just going to go advocate for it, right? That is many years of working and thinking about that. So he would self-advocate. So he would self-recognize the issue and also even come up with a potential solution to the problem. So when you hear these success stories, a success story typically is something that has been in the making in long term. And so we just really, when we talk about things like visual supports that are used in the school, right? I will say directly to all of you, please go back and look at, for example, the schedule you're using, your daily schedule for your student right now, no matter what age they are. Go back and look at that and figure out what level of independence do they have with that support for their day, right? Because this is the thing that helps them guide themselves through the day. How much prompting is happening by an adult? Know that, right? If you're at 40% of prompting, let's figure out how we can get past that, how to make it better, and how to continue to make it portable and not stationary, for example, right? Having the student use it independently and having access to it at all times. Sometimes it's held, sometimes I've seen this in the field, by the actual adult and not by the individual. So something you can do tomorrow, do after this webinar, just take some personal inventory on the level of independence your students have with even just that simple daily schedule that we all have in some way, shape, or form. So we go back, one of the tools that can really support independence is mobile technology. It's here, it's great, the prices have come dramatically dropped. So for the students, we really encourage you to think about how we can use mobile technology.
Yes, and that's why that's our next tip, Shawn, is really to think mobile technology. It's part of our world. It's part of the world that we all live in. We use it every day. We count on it. Truly, we panic when we can't find our cell phone or our tablet. So we want to use this. Many of your students with autism will respond extremely well to technology. And it doesn't mean that we're going to run out and buy an iPad for every student or another type of tablet. It means that what we want to do is consider in our planning what kinds of support does the person need? How much of that support is being provided by others, a body, somebody either directing them verbally or even maybe physically, or are they not open to that at all? How can we use mobile technology to help move that person along with their goals and into adult life? We see it's a teaching skill or teaching tool for skills, and it also can work in the social network. The best way to really make this emphasis is to look at some case studies. This first case study is Jeff, and he's 21 years old. He was identified with an autism spectrum disorder and had some pretty typical kinds of characteristics. And Shawn, when anxiety rises, so do some of these stereotypic behaviors.
Sure.
And so those also actually equated to more challenges, so you're into this sort of negative cycle. Unfortunately, even after working with a job coach for 2 weeks, they found that he was still struggling to do the job, to remain on the job, and his anxiety was still a problem. So technology was the next step. And so this particular team decided to use the iPod Touch with just some very basic tools that are on the iPod Touch, the clocks, being able to show a step-by-step task. And as you see here, it really is almost unbelievable in some ways that after using this device for 1 week on his own, he was able to do the job, no outburst, and the true success is that a year later he's on the job and still using this device. Gentry did this work back in 2012, and so we know that there are so many even more options at this point. This next slide shows you that there are more success stories out there. This is more research that was done with individuals with ASD, but also with other individuals as well, different ages. It's not just for the young people.
That's right. That's right.
And for different challenges on the job. Being able to transition, being able to be independent, being able to complete your tasks, being able to stay calm, being able to do those step by step. So the technology varies. It's not like we are suggesting that you go out and get a particular device or a particular app. You need to know what it is that the work, what it is that the person needs to be able to do, what are their needs, and that will help sort of drive the type of technology that you need. The outcomes you can see here were pretty dramatic. They made a big difference in the way that the person was able to do their work and their success on the job. So technology is something very much to consider. This graph tells you that a place to start is really to start with thinking about what are we doing right now? What are the job experiences or challenges that we have right now, and how are we addressing them?
Yep.
Are they people supports? Are we asking people to come in and do these things? What have we done already? And then you ask yourself, are there places where technology could be used to help make the person more successful and more independent? So transition supports in technology, very important.
And then before we put it all together, what we're going to talk about is looking at focus on social competencies.
Absolutely.
Not all social skills programs are going to get the result of really getting you to being competent of the entire environment. Part of that is what we need to do is it's not about writing a social goal, on an IEP and going to another room and doing that. During your day, and this is really challenging, we understand too, for educators, is you have academics you're doing, you're trying to get through all of that all throughout the day, and how do I address this as well? One strategy is just to write down the things that you know need to be worked on that you see happen, and have all folks on the team kind of writing those down, because it's in context that it has to start, right? You catch it in context. Part of that is understanding that the more you're together, the more the individual is in settings that are social. We don't want to repair everything prior to it happening, right? We can't be so proactive, but we can help later explain what that means so that they become more competent and ask those questions. I'm a watcher of The Big Bang Theory, as you are.
Yes.
Sheldon will often say in a time of stress, if Chris was stressed out, the protocol requires me that I offer you a hot beverage. And that is fine, but he's able to, he knew it, right? And he'd been taught the protocol of what he should say to you. But is it always the most appropriate and fluid? And so it's one thing to have the skill, it's another thing to really use it as much as possible. And part of that just takes practice and catching those times and picking up on them. And again, I understand there's so many things to do in the day, but it's imperative when you're thinking transition and thinking adulthood, the lens of adulthood. This is the lens of adulthood, right? And so we have to step back and think about that. Is it just a lack of knowledge they may have for that particular skill? Can they perform it? What other issues are getting in the way potentially? And are they motivated? Probably not always motivated for that particular skill, but we still have to think about it and teach it as much in context. So again, not wanting to go through the slides and just to read through them, but as you look at these, here we're talking about knowledge of compliments, understanding that I know when to offer the compliment, but it may be hard to decipher when and where and in what context. The performance of it, during that there may just be too many people to initiate the social interaction that the student wants to have. That's a difficult position to be in. How do you get into that group when you want to say something, but it's such a challenge because the social context goes so quickly, it's so fast, and again, it can just take there's many strategies to do it, but it takes time to practice those. But first you have to recognize with your lens of adulthood, what are the ones that might be a challenge. And finally, motivation. It's not that you're always going to want to do it, but if you can give the context of why it's important and why it's important in adulthood, it's not taking away from individuality, right? But it's really helping you potentially connect and folks wanting to connect and just not having that window and understanding the window of opportunities that may be there.
Well, I agree. And I think that once we help someone be successful and they experience it, we give them the opportunity to decide, did I like that? Do I want to use that in the future? How did that feel? Was this something that made me feel like I have learned something that I want to continue to use? So I do think that it's important with our folks on the spectrum, as Shawn said, is that you have to know the area that you want to target. Is it just simply that we have to tell them why you want to offer compliments, the knowledge of how to do it? Or is it the fact that I know how to do it, I'm just so anxious I can't? I mean, each one of these is part of your assessment to know where you need to focus your intervention. And many times when you figure it out this way, you offer our youth something very special that they haven't gotten in that traditional social skills curriculum.
Right. I mean, and often what we find is that they're in the context of a cooperative group in school, and an issue happens. Too often we just kind of correct it instead of figuring out what was the issue. What socially did he or she need to do? What socially did he not understand that his partners were doing? But all of those, there's so many of those that happen on a day-to-day basis. We really need to write those down, and as a team start to think about, well, this has come up. We really need to begin to directly teach that skill, and then make sure we see it from a quantity perspective, that we see it more often, and then that'll turn into quality. We see it all the time, where once they've practiced it plenty, it gets into, like you said, more success. And then there's the hidden curriculum, which is so important for folks to begin to understand.
And it's part of all of this social competency.
Right.
We just assume that people know a lot of the information that you and I have just picked up along the way. So the hidden curriculum is that set or guidelines that are not usually taught directly, but everyone is assumed to know them. And they are foundational to being successful.
Right.
That's what people are looking for in terms of an employee, that they can walk into a situation and just figure out, oh, this is a time where I need to be quiet, or this is a time where I need to initiate, or how am I going to help that customer? Do they look like they need help, or do they want me to stand back? How do I know that? It's part of that hidden curriculum. And so we need to start figuring those things out and teaching youth. This is just an example. If you haven't had a lot of information about the hidden curriculum, it really is about perspective taking and sort of reading between the lines and understanding it. And so there are lots of examples, and here's one that was written by two young men with Asperger's syndrome. And it's about sort of describing and explaining the act of kissing. And kissing, as you know, Shawn, is not the same with your mother, your wife, your girlfriend. It varies from person to person to person. So I think that for these young men, they had to almost examine it and explain it in a very detailed way, something that you and I would never think would be necessary.
Right. We're here at VCU today, and there was a nice sign in the hall explaining that we're in the library, and here in the library, each floor kind of has a different social acceptance. A couple of the floors are more open to conversation and working in a group, and a couple of floors are very silent. It's nice that support's there for all students, that they understand that, but that also changes when you go to the local public library,
Right.
that they may not have that. So if you take in context, you go and talk, and people are looking at you kind of, odd, right? It's kind of helping people understand, yes, that context will change. Not everybody's going to have it written like they do here.
Right.
And so there's just many of those that happen each and every day. And literally try just to pick up one every day that you've written down that you go, I'm gonna work on that at some time. I know I can't get to it right now. And quite frankly, I would suggest you don't try to repair it in the moment. Really step back and teach it over time.
Right. It's first understanding and identifying it, and that we as the support people, we as the teachers, we as the families start to recognize those hidden curriculums, know which ones are really important, which ones might be nice, but which ones are really important, and then start to teach them in a planful way. Hidden curriculum on the job, there are tons of them, and it depends on the job. So you can see here, there's just a couple of different ones to think about. So on this slide, you'll see where it says that when the boss says to you, don't you have something else to do? Shawn's my boss. What he means is that you should be working.
Never.
No, Shawn would never do that. He really wouldn't. So, but there are bosses that would do that, and that is what they mean, and you need to understand that. There are other hidden curriculums there, like if the boss suggests to you that you do something in a certain way, it's probably not okay to tell him that's a really bad idea and that I know a much better way to do it. Now, what we could do is work on some self-determination, helping the individual know how to say to the boss, I'll be happy to do it that way, but if you're interested, I have some other ideas. That's perfectly acceptable. So hidden curriculum, the first step is really to identify it and then to work on it. At OCALI, we have Casey again, and he had to suffer through a lot of the hidden curriculums at OCALI. One being that there are so many more women at OCALI than men, and at least when he first started, we had so many more women, and so we do a lot of greeting and talking and wanting Casey to talk back to us, and we needed to prepare him that even though we're trying to tell everybody to give him time, you will be greeted a lot, and that's okay. And actually the hidden curriculum goes on further to say that it's okay if you just smile or you just nod your head. It's fine. We had a number of things happen, like if the doors are shut at OCALI and we're having a meeting, or maybe it's just people would rather have them shut, it's still okay to come in, dump the recycle bin, don't just skip it, which is something that he thought. So there are a number of things that he had to learn, and by teaching him straight out, we were able to avoid a lot of anxiety with him.
Right. I remember Casey waiting outside my door and not knowing to come in or not, and just had to let him know I'm never doing anything that important. So
feel free.
And finally, we're going to put this all together. And again, we respect what you do and how you do it, and all the work that you put in. We hope these tips have been practical. This is a very simple tool called the Comprehensive Autism Planning System. We call it the transition, revised transition one, that really gets into looking at the training needs and supports that are needed. So again, that if we're going to help, how are we going to help? And again, how is that going to lead to some independence? Reinforcement that's needed throughout the tasks, social and communication supports, sensory and biological needs, environmental and suggested natural supports. Again, these are needed all the time. And so you just open it up to say, hopefully over time, if you use this tool, it just becomes a lens of how you begin to support people. It's not that you have to fill out this out every time. It's that you begin to think like this when you're setting up your support. So for Pia, who liked the garden center and this work experience, is something very reinforcing. We provided written steps for each of the gardening tasks. Again, instead of the adult doing it and taking them through it, let's just write it down and see if we can use the independence there. Might be a time for the mobile technology at some point. Using boundary markers to identify where to plant, the flowers. Gardening services are very natural for her, and so she enjoyed that part of it, which is great for Pia. A very good job match for her, but a reinforcement was to take some things home. So that's wonderful. She had a PECS book that she used, and we want to make sure that the most frequently used were up front for her as well. There are prompts for bathroom and meal breaks so that she would take a break was needed for Pia. Sensory and support other supports that were put in. There's a hat with a brim and maybe some sunglasses. The days can get very bright, and again, if she needed them, then to advocate for them as well because of I'm getting a headache, kind of and recognizing that within her system. Request to work away from a busy road and too much distraction and noise. Using a timer for those breaks, using boundary markers as well. And then a coworker was checking in with her every 45 minutes. Again, part of that is making sure we have that connectedness that we talked about with Casey and what would be appropriate. So again, I don't want to go on longer than 6 minutes talking about it because it's a 6 minutes gap. So just again, a very simplified tool to use for all of you. So when we go back and we think about what we're really looking at today and these tips, we have some resources obviously in there we want you to potentially use, but they're really about how we are approaching the transition process and making it a priority. And what should we prioritize? Well, first thing we need to prioritize is that we believe in what they can do, and we're never a cap to that success. So believe until you believe, and we don't know what the future holds, so let's open it up and keep it that way. Using the lens of adulthood, that's where we have to project and know what that things might look like in adulthood, or what we would like to see in adulthood. Using the lens of autism, so we know those areas that might be a challenge, and we can help support those and consider. Help is not always helpful. This one is one that we can't overemphasize. Help is helpful if we're thinking independence first, and we're thinking about the supports that we can put in place, which will take some time. Thinking about mobile technology, it's a part of our world, so let's go that way. Focusing on that social competence, that is, I think, most recognized, and we all seem to recognize it, but when it comes down to being in that school day, we seem to fall back on making sure that T's are crossed and I's are dotted with the academic side of it. And the one that's going to be so important in the future is that social competence, and then putting it all together. And that is what we were talking about with the first slide, that we know what the outcomes look like, and only you, and we respect that, can really help to change and prioritize and to look long term in a different way, so that the outcome is very hopeful and very bright.
Yes, there's lots of good transition information that's available that covers all disability areas. You need to use that information as well. These tips are really things that sort of rise to the surface when we talk about youth that are on the autism spectrum. And again, I echo what Shawn has said. We know how difficult your job is. We know that you have many competing priorities. So try to take a few of these tips, maybe one or two at a time. Focus on it and see if you can find new strategies, new ways of really approaching transition for your youth with autism. If you have questions for Shawn and I, there is a venue to be able to send questions to us. We'll try to answer you and point you to some other resources if you need it. Thank you for spending 45 minutes with us. We know that your time is valuable.
Thanks much.